Hi, and welcome to 2-Minute Tips for Autism. I have one of my favorite doctors here, Dr. Usman. Thank you so much for being here.
You're welcome.
Well, I know we've talked a lot. I know why you're passionate. I know how amazing you are in our community. I want all of them that might not have heard about you yet to understand, why are you so passionate about this cause?
Well, it has to do with the fact that I have children of my own, and 4 of my children, I have 4 kids, and 3 of them have medical issues. And I couldn't get the answers I needed for them when I went to their regular doctor's offices, so I had to start to research and learn and figure out how to take care of them. And in my journey of learning how to take care of them, I came across kids with autism. And in the last 15 years of doing this, it's become such an epidemic.
Yeah.
And so many families are struggling that, we just need to work together to try to help our kids.
And being a mom, you know what it feels like to have children that have some type of...
Yeah, my kids have allergies, asthma, diabetes, chemical sensitivities, arthritis. And so I've had to deal with a lot of those types of issues that our kids with autism also have.
Now, what I want to ask you, because we've talked a lot, and if you guys have missed any of the other YouTubes that we've done with you, definitely search for some of the other ones, because you've done just a great job answering a lot of questions. This question, I think, is really important for the newbies out there that are just getting the diagnosis. As you were talking about, this has become an epidemic. There's 1 out of 68, I think, is the last numbers I've read.
I know, it's crazy.
And so what would you tell a family that are just newly diagnosed? What are the first 3 steps you would recommend for them to do with their child right now today?
Well, I get that question a lot because we have patients who come in and they've just been diagnosed, and the first thing a lot of them are told is that there's no hope.
Yeah.
And that's the first thing I want to tell them, that there is hope. And that they've been diagnosed, their child's been diagnosed with a mental condition. And the other thing I want to tell them is it's not a mental condition, that it's a medical condition that has mental symptoms.
Oh, I like
and
that.
Their children
I like that. That's a good way of thinking about it.
Yeah, the children are manifesting these mental symptoms, but really a lot of their symptoms are coming from medical issues. A lot of their symptoms are coming from gut issues, for instance, and specific dietary issues as well. So that would be another thing for them to understand, is search for the underlying medical issues. Find a good doctor who you can work with that understands some of these, what we call biomedical issues.
Okay. More specialized with autism.
And then talk to other parents. Find other parents that have been through the journey and talk to them and find out what helped and what worked. And there's a lot of non-for-profit groups out there that are helping families. Your group, for instance. And, groups like your group, TACA, NAA, to help that journey, to help along that journey.
Because a lot of us, we've been here longer than we really quite understand even ourselves sometimes. But I know for myself, you look at another parent and they've done that walk. And it doesn't mean that everything they've done is going to help your child.
Right.
But being able to understand all the different options that are out there. And there are so many options, even in the last 10 years, that I've even been in the community watching what other parents done, going, well, wait a second, I didn't do that 4 years ago, but maybe now this year, this might make more sense.
Yeah. And, there isn't a lot of treatments that are FDA approved for our kids. And the treatments that are strong psychotropic medications. And I would use that as kind of a last resort if you really had to, and not a first line option, because there's so many other things.
With diets and
supplements and nutraceuticals and amino acids and, omega-3 fatty acids and treating the gut and treating underlying seizures and
all these different
treating
things.
Underlying mitochondrial issues. There's so much to learn. So it's a process. And
definitely. It's not a sprint. it's not a sprint. It's a marathon. Yes. So now if somebody wants to find more out about you, how do they find you?
Well, I work at a clinic in Naperville, Illinois called True Health Medical Center. I also own a compounding pharmacy called Pure Compounding Pharmacy. So they can Google us, and we're on Facebook.
Okay, wonderful.
Yeah.
So you're a busy woman.
Yeah, I am. I am.
Thank you so much. I know in your busy schedule to take this time with us. I really appreciate it.
You're welcome.
And thank you to you guys for watching 2-Minute Tips for Autism. Until next time. Bye, guys.